more minute, let people start arriving, and then we'll get started. Emily, do we have everyone we need?
Yes.
Okay, so good afternoon and welcome to the We're in This Together Iowa City Area Business Partnership, Iowa City Downtown District, Iowa City Area Development Group, and the Think Iowa City Collaborative Webinars. We're in This Together is a joint venture of those area programs, and it's had a pretty successful run here with these types of webinars. So today, the focus will be on public health and TestIowa. My name is Katie Gerlach, and I sit on the board of the Iowa City Downtown District, and I am the Director of Strategic Operations and Resource Management at Shelter House in Iowa City. So I'm here today on behalf of the Downtown District, though, and on behalf of the team of the We're in This Together group, just want to say thank you for joining us today. The purpose of today's webinar is to provide a venue for our business community to start thinking about what the future holds as we see our neighboring counties begin to reopen, and to start making some considerations for shifting in business models here, reopening our community. Hopefully today will provide a space for us to start to address some concerns and questions that are pressing for folks. Today's focus is really on rethinking the business model, staying agile through changes in consumer habits, public health concerns relating to those, and maybe just taking a moment to plan for the future. And we will also talk about the TestIowa program, which is starting to grow and launch in our area. So we're in this together. I would like you to take a moment, if you haven't already, to visit the website, icareatogether.com, for the latest news and resources related to the COVID-19 recovery. In the coming weeks, it's starting to shift from crisis mode to recovery and reopening, and they're developing content now that will help you plan as you go for protecting your employees, your customers, and making the most of your SBA funding and new guidelines as they're coming out from both OSHA and the CDC. I also want to mention quickly that there's an upcoming webinar next week. Food and Ag will be the focus. Josh Schomburger from Think Iowa City will host that. See if I can do this correctly now. Today's panelists are Dave Wilson, who's the Director of Johnson County Emergency Management, Sam Jarvis, the Community Health Manager of Johnson County Public Health, and each of them are available today to answer questions. We're going to run this in a totally Q&A format. They might have some brief remarks to open, but otherwise we will just take questions. I would like to show you, there's the upcoming webinar, how to ask questions. So in order to ask questions during the webinar, you'll want to open the Q&A box, submit your question, and then I'll be observing those and we'll be able to direct those to our panelists. So I'll keep this slide open. Or not, we're all back. All right, Dave and Sam, why don't we start with you, Dave? Maybe do a brief introduction of what your role is at the county, what you're seeing day to day, and what maybe get us started with some information about TestIowa here locally.
Since 2007, including this pandemic, I think we've had 6 or 7 Stafford acts. I've kind of lost track. So I've managed those for the county. Basically, our function is to help the community prepare, respond, and recover from all hazards, disasters. Most commonly, they're weather events. Occasionally, they're hazardous materials. We also do things for the nuclear power plant as a host county out of Lynn County. And for this, basically, it's been the coordination effort of the response and recovery with Dave Coach and Sam Jarvis acting as the lead agency in the public health response. So Dave Coach has actually been the incident commander for this event, and we've kind of coordinated the resources, the preparedness, and all those wraparound services that go into basically any disaster. I think you talked about TestIowa. So the TestIowa thing has been rolled out statewide. However, we do not presently have a site in Johnson County. I just was actually watching out my window. A couple National Guard helicopters were landing to drop off some kits that they're going to run by vehicle then over to State Hygienic Lab. So State Hygienic Lab is the test site in Iowa that's processing those. They're running the traditional testing panels that are coming out of a variety of different places throughout Iowa. And then in parallel with its own dedicated staff, they have an additional testing focused on the Utah contract and the TestIowa program that Governor Reynolds rolled out a little over a week ago. It's kind of all a blur now. I think we're on day 55 of the response, and I lose track of even what day of the week it is. So we are prepared to stand up a site should we get a site. Anyone is welcome to go on the website and take the questionnaire and then select a location and go be tested if you are so chosen by the survey system. I know Sam and I both went through and did it. The site closest to us, last I looked, which was about 24 hours ago, was still in Des Moines. Basically, you are given if you're selected as a person that needs tested or that meets their criteria, you're given basically a QR code through the app, and that follows you through the process. You choose a site to go be tested. They give you a reporting time frame to go up and do that. And my understanding at Des Moines is the process is ran pretty smoothly. They're trying not to overwhelm them. It's not a free-for-all, so you literally have to do the assessment. That's step one. Log on to the TestIowa site, be selected or not selected. That's entirely up to the algorithm. And then choose your site. If there's one that's convenient for you that works, report to the site and kind of go through the process. So that explains about as much as I can tell you. We are set up here in the inevitability that we are chosen to be one of the sites. We're ready to go with a couple different locations, but ultimately it's up to the governor's office and IDPH, Department of Public Health, to determine if the site that we've chosen that we'd like it to be done at is a site that they agree with or not. And that's kind of about it for the response piece. I mean, gosh, it varies. 1 minute we're doing personal protective equipment for nursing homes, hospitals, and frontline workers. The next minute we're dealing with homeless and vulnerable populations in the community. The next minute we're dealing with public information officer requests through our PIO staff, Kelly Andreessen, Brad Friedhoff, and a number of other folks dealing with elected officials. I mean, it just literally changes minute to minute, which isn't unlike any other disaster. Just the volume is almost crushing. We're on day 55, and I think the lowest day I've averaged has been like 205 emails. And that's just one platform of contacting Dave Wilson. So it's pretty daunting. We've got good partners to work with. Everybody from the private sector, from Think Iowa City, all the different districts, all the different groups, Patty Fields and United Way, to our normal traditional folks that we deal with, public safety, public service agencies, the elected officials, you name it. I mean, the great thing about working in Johnson County is generally everybody focuses on the problem at hand and wants to resolve it as quickly as possible and get to that recovery piece, do what they can to mitigate the risks so that the next time, whatever the problem was, it's less of an impact on the community. And I think we've generally been pretty successful at that. I think back to the '08 floods, which was obviously a historic event throughout Iowa, and we were, light years ahead of many other communities in our recovery. So I would expect this to be no different. The challenge becomes, we have zero control over the spread of the disease outside of the mitigation attempts that we can all make. So the public health mitigation efforts are really our control. So as a person, we can't control the virus any more than we can control the weather, right? But we can control how we respond to that. And I think what you'll hear Sam say a lot is those smart public health measures that we've encouraged from day one and really should be part of our normal lifestyle through any flu season are the things that we can affect the most. So, covering your cough, staying home when you're ill, doing good medical surveillance, getting your flu shots, getting your immunizations and vaccines, good hand hygiene, good cleaning, wearing appropriate personal protective equipment for your level of risk and your job duties. Those are all the only ways that we can truly make a huge impact. And they are very successful if we follow them. But again, that's up to everybody to do that, you know. So it really becomes incumbent on the people themselves to police themselves.
Yeah, and I guess maybe another thing that the government and regulatory agencies can do is provide guidance and also some measures to also help control virus spread. And one of those, maybe Sam, can you talk a little bit about your work with the county and maybe what businesses can start thinking about at this time?
Yeah, sure, absolutely. One, thank you for having us, having Johnson County Public Health here today. As always, it's great to be able to make contact with as many people as possible about this, because we know, even though there's tons of information out in the news and everywhere else, you know, we want to make sure that everyone's getting the specific information for either Johnson County or for Iowa. So my role here with the health department, I get to work with our disease prevention specialists or disease investigators. We've also shifted many of the staff in the community health division to support the COVID-19 response. And so it's varied from working with Kelly Andreessen in the board office with our public information, just making sure that we're getting timely and accurate and the correct information out there as soon as possible. Or if we've switched and onboarded other staff to help us with disease investigations, because I'm sure everyone's aware of with the increasing case numbers and the expected peak. We wanted to be prepared for that, and we've been very successful getting staff trained to do that, as well as some other technological advances to be able to meet that demand. But really, from the beginning, you know, early on was containment and doing the best we can, and knowing that was, you know, potentially inevitable that COVID-19 would be spreading across the state and the nation. Doing our best to be able to do that disease investigation and contact tracing. And then now, obviously, to what everyone is very familiar with flattening the curve. And so that's been primarily our role as a health department, and coordinating with all of our partners. Dave Wilson and the Johnson County Emergency Management Agency is a wonderful partner, and they've been a huge support. And we could not do this without them. So thank you to Dave Wilson and Travis Beckman and all of our other responders and healthcare partners and everyone else that's on the 3 o'clock Emergency Operations Center call. It is a community response. There are many people involved in this, and we appreciate everyone, because this is affecting all of us in different capacity of our lives, and we're all connected to it. So,
well, maybe we can start, Sam, by talking a little bit about the next phase of this and testing. Should employers increase, one of the questions from the audience today, should employers have employees get tested prior to allowing them to work, with maybe through the TestIowa program? Legally, maybe what are some of the issues surrounding that, and what are the public health recommendations for that?
Right now, you know, the recommendation has been, if you're symptomatic, to seek care potentially, and you know, obviously, depending on how severe your symptoms are, to get a test. If you're not experiencing symptoms, you know, you could get a test today and test negative, but in a couple of days you could be positive, or in a week you could be exposed from being out and about or close contact with someone. So getting tested just to go to work would probably not be feasible or really all that helpful generally. Again, it's going to be really important to work with employees and employers to look at their sick policies and make sure that everyone's on the same page, and having employees and everyone check their temperature, screen themselves for symptoms, and just really know that if you're sick, please stay home, and just really be able to have that good conversation with your employer.
So, and this question can be for Dave and Sam. Now that we're in a community spread phase of the virus, it seems that it's possible that we've all moved into the medium risk enterprises under OSHA regulations then. And can you talk more about what sort of opportunities there are, and what employers should really be doing to protect their employees? Should they be providing personal protective equipment? And in what ways can they do that without risking supply chains to medical providers?
Yeah, great question. You know, again, David mentioned it earlier, you know, looking at addressing what the risk is and what their kind of their duties and other activities that they engage in. You know, right now we're under a PPE shortage, and so if you're not a healthcare worker, we're asking people to be cognizant of that and make sure that those N95s and surgical grade or medical grade masks are reserved for them. Well, I think it's gotten a little bit better. There's still an issue. There's still issues out there. There's certainly issues across the nation. So cloth masks and things like that are beneficial. And if an employer is able to do that, I think that's wonderful. I think that's not only a smart move, but it's also reassuring to employees. Again, you know, with gloves and things like that, again, that's, you know, there are medical grade gloves. Again, we're asking that those are reserved for our healthcare workers on the front lines right now. But, you know, let's also be mindful that there's no good substitute for good hand washing. And really just understanding that process. And, you know, even if it's something as, you know, silly as it sounds, as intervaled hand washing throughout the day, every so often, 30 minutes, an hour, reminding employees that they're touching high touch surfaces or sharing a lot of equipment and wiping those down. There are a lot of other kind of employee practices that can be implemented. So, you know, because even if you have gloves on and you touch a bunch of things and then touch your face, you know, that doesn't help the situation. You're still kind of exposing yourself. You know, I think there is some thought that if you wear gloves, you're cognizant that they're on your hands and you won't touch your face as much. But, you know, we know that still happens. And so.
Yeah, I would echo what Sam said. You know, it's interesting to hear the dynamics of this scenario and hear how many things have become new catchphrases. So a lot of what we preach goes back to any virus season. And it's the simple things. I mean, we can't reinforce that enough. You know, you need to be responsible as a person and say, if I'm sick, I'm going to stay home from work. And if I'm not getting any better, I'm going to, you know, seek medical care or try and get tested, because there's a number of other things that people are still getting tested for. It's allergy season, huge problems with allergies for people with allergies right now. Influenza, we're still seeing influenza A and B out there. There's a ton of different things. But if we do the same core basic things, regardless of what the virus is, because there'll be something else next time around. It won't be COVID-19 coronavirus. It'll be, you know, something new. So we just need to remember that the basics are always what works the best. If you're sick, isolate, you know, home isolate, home quarantine, treat yourself symptomatically, keep things clean. It starts with your hands. You know, we all, whether we want to or not, touch our face and our oropharynx and our eyes way too much. And that's the number one way that we spread germs and viruses into our mucous membranes and our respiratory tract, is through our eyes, nose, mouth, our facial areas. So there is no replacement for soap and water, and good 20 seconds of hand washing are still hallmark. We've gotten lazy, and I'm going to say it. We've gotten lazy, and it's all convenience about hand gels and hand sanitizers and wipes. When I started as a paramedic 30 some years ago, it was 1 to 10 bleach and water, and that killed most of the viruses, and to this day is still incredibly effective as a cleaner. 1 to 10 bleach and water solution, routine laundering of linens, routine hand washing, and then again, conserving that medical grade PPE. I mean, I see some folks out there now because, you know, the simple ear loop surgical masks are becoming more and more available. And so you're seeing those all over Amazon, eBay. Amazon's done a good job of trying to restrict medical grade stuff, but you see that out there, and it really should be the focus of what can I do at the least impactful to the supply chain to contribute. And the number one thing is, again, environmental controls, you know, try and limit touch surfaces. I've seen a lot of plexiglass go up at grocery stores. We've done some of that at the county administration buildings. I think you're going to see more and more of that. Just droplet barrier protection so that we can limit the amount of droplets that come out of our mouth when we talk, and that you see it at Casey's, you see it at Hy-Vee, places like that. Routine cleaning of those high touch surfaces. The least we can handle money, probably a good thing right now. And if you have to handle money or currency, then try and wash your hands immediately after. Yes, hand sanitizer is available. It's not available in the quantities it once was. There's a lot of people like Sea Ridge Winery and others, Iowa Prison Industries, have stepped up to make that. But again, those core fundamental things that Dave Coach, Sam Jarvis, and I have been preaching all along, and we should really be doing every flu season, are core to the success of any outbreak. You know, we started preparing back when I first started for, I think it was H1N1 first. Then we had an avian flu outbreak in part of Iowa. Then we had Ebola. And so we had a lot of PPE, and we'd done a lot of preparedness, and we'd written the original pandemic plans based on all those things back then. And little did we know, flash forward to, 2020, and it would be coronavirus, COVID-19 coming out of China. But luckily, we had done a lot of that preparedness, and we had drilled a lot of tabletops, and we had done a lot of hands-on things through, mumps outbreaks, different things. Again, I take business owners back to the core fundamentals. Have a good, honest heart-to-heart policy with your staff about the worst thing you can do for us as a business is show up sick and spread germs, because then we are going to have a lot of community spread. That's why you're seeing buffets and places like that not be opened right now, right? They want non-buffet services open. Pens, people touch pens all the time. Make it your pen, right? Use your pen. Stylus, I always cringe every time I have to punch the keypad or swipe my card. I've become a big fan of Apple Pay, and I use an Android device. So those touchless payment methods or paying over the phone are all really great things. But anything we can do kind of environmental control wise to protect not only our customers, but to protect ourselves and our business is great. So start there. Make sure we've got good policies on keeping things clean, providing isolation barrier protection, provide the appropriate level of protective equipment to our people. There are a lot of reusable gloves that can be laundered or decontaminated with bleach and water. And then those health and human resource practices from an HR standpoint of, we would rather you stay home and self-quarantine and get treated at home than come to work and make other employees sick or our customers sick. I mean, those are all smart things that we should practice all the time universally. And I think any public health person would echo that.
Recently, Costco, I think it was today and yesterday, I've started talking about requiring customers to wear face coverings to enter their store. Can you both talk about maybe what is that a good requirement to have on the entrance to your door? Do you need to provide the mask? And again, trying to avoid any PPE shortages, maybe just making it a norm and custom that we all carry a cloth mask around.
I think that's a great idea. When you look at what the cloth mask requirement is or recommendation is, that if you're unable to socially distance, please wear one, because you're protecting others potentially if you're asymptomatic and don't know it or ill. And so, as we see places open up and we see people begin to kind of come out of their homes and everything and migrate to other businesses or locations and gather, if they're not able to socially distance at 6 feet, I can imagine that the recommendation will still be to have that cloth mask. And so if you've got a shop or an area that's smaller and people aren't able to, and then we're seeing with the projection of opening up to 50% capacity, and they're still within that 6 feet, I think that's absolutely a wonderful idea to ask that of the public, because it not only protects your employees, but I think it's a demonstration that you want to do your part too. So
I fully agree with what Sam said. I think there are recommendations, and most of what you see is recommendations unless it's a requirement issued by the government. And so what you're seeing right now is a lot of businesses look at those recommendations and look at those best practices and say, how can I institutionalize those in my business and keep my employees safe, keep my customers safe, honor the recommendations that are out there, and still try and reopen and run a successful business so that we're not, the site of an outbreak or we're not an outbreak institution. At the end of the day, most of these businesses are just that. They're a business, and so they can set their own rules. They can determine to a certain extent how many people they have in there. And what we've seen right now is a lot of guidance that for these openings to be 50% of your normal capacity. Try and maintain no more than groups of 6. I think it was 6 or 10. The numbers kind of run together in my head at a table. Try and maintain that 6-foot distancing. We've seen a lot of places mark off aisles. I was in Hy-Vee recently, and the aisles all had on the floor one-way traffic patterns, which of course took me about 2 aisles before I realized I was violating the traffic pattern in the store. So I was a bad example. But you can do all kinds of things as a business owner to help reinforce those positive messages. And at the end of the day, I think it's all our responsibilities to do what we can to make sure that people stay healthy and that we limit the spread of any disease or any virus. And by doing those core fundamental things, I just think that's a smart business move as well. It shows to your customers that you're trying to make sure that everyone's safe.
Yeah. What are some other techniques, do you think, public health wise, Sam and Dave, that employers and businesses can undertake? So we've seen disposable soft silverware, such as those things happening in the other counties that are nearby. It's worth reminding that we're probably not anywhere near that same reopening in Johnson County, given our numbers, but it's good for businesses to prepare and plan so there aren't shortages of those kind of supplies.
Yeah, absolutely. Again, looking at all your processes and different things that go on throughout the day, and just kind of understanding where those can be broken up. Either it's having hand washing more readily available, hand sanitizer when it's not. Again, you'll see more hand sanitizer, but it's usually put in places where you can't readily get to a restroom to wash your hands. And so that's really where that comes into play. It's a good alternative, but it's not the best choice. The best would be hand washing. Other things that we've read and seen, staggering workstations and making sure there's that distance between employees and the public. David mentioned the sneeze guards, the plexiglass that's going up. So there are a lot of different ways to do that. And, it'll be interesting. And I think we're in a bit of an advantage right now. And it's silver lining to where we're at in Johnson County. And that advantage is the fact that we've seen what happens when a region, the RMCC regions, hit that threshold. So we know what that looks like. We now know what it looks like for the other 77 counties and the guidance that they're under. I cannot imagine that guidance being altered in the future. And so when we get there, we'll already know what that's like. And so it'll be important to kind of pay attention to what some of the other larger 77 counties are doing and what's working well for them and what's not. And so being able to, if you have contacts in those counties or paying attention to the news and what's going on there, I think it'll be really important, and you'll be able to kind of get a glimpse of what our future might look like.
Yeah, I'd absolutely echo what Sam said. I think it's really important that we look to the other 77 counties right now and see what things work well when they do their reopenings and what things are opportunities for improvement or lessons learned and hopefully remembered for us, so that when we get to that point as a region, whether it's Lynn County, Johnson County, or wherever over here in the last of those counties, that we're taking those best practices and system improvements away from the other 77s that kind of went first, if you will, and helps us refine our practices. I think that's really important.
I've got a couple of questions and statements that have just popped in, and folks are wondering about maybe increased regulation for food safety as we move into the next phases. This past weekend, someone went to a restaurant or was actually out and about taking photos of different restaurants, and there were staff that weren't wearing masks or gloves in those stores, which kind of raised alarm bells of, well, if that's happening on the outside, what's happening behind the closed doors in a small kitchen? Are there going to be any increased regulations for food safety or other items as they move forward towards reopening to increase public health?
In terms of increased requirements and regulations, I'm not exactly sure, and I'd have to defer that to our environmental health division, who does all of our food inspections and things like that. But I know the Department of Inspection and Appeals has placed guidance as well as a Q&A, and so I would frequently check that to see how they're handling the questions that they're getting and coming into. I think there will be the existing food code that all of our restaurants and establishments are very aware of, and going forward, it will be continuing to keep that in place and implement that on top of the recommendations for COVID-19. And so whether those will become more requirements and kind of interrelate or combine. I don't know, but I think it would be smart practice to look at what the recommendations are and not only implement those and implement what works well for your facility, but be vocal about them too. Because again, you mentioned that someone was out and taking pictures and kind of looking at, as a patron, what is my risk going into this facility right now? And so being open about it and sharing, hey, these are the things that we will be implementing to protect our people and you, I think would be very beneficial in the future.
Yeah, I'd agree. The other thing we've had questions on as well, do we go away from the normal types of menus, and do we use like a laminated menu that can be wiped down and reused after each one? I think any of those types of engineering processes that we can put in place at our businesses, whether it's things that can be wiped down after customer use or re-sanitized, those are all just smart business practices, right? It's going to be pretty expensive for small business to constantly produce paper menus and throw them away after each individual customer does that. The video screen display boards of menus are a smart practice. They don't have to touch a menu at all, then they can just see it. Even some of the restaurants that have the small touch screen menus on there, those can all be cleaned right afterwards. And again, in compliance, at the end of the day, it's your business, right? So if you've got a business practice that you've made well aware to your customers and the public, what your expectations are of them as a customer to your business and of your staff and what you're doing as a business owner to protect your staff, your business, and them. At the end of the day, you have the right of refusal as a service. So I think the best message is a positive message. So I would encourage business owners to say, look, this is what we're doing, much like you saw on the front end of the coronavirus when all these statements were coming out about what's their business doing to respond to COVID-19. I think as you're getting ready to open your business, any statements that you can make to your customers and the public in general about these are measures we've taken as a business to protect our staff, to protect our customers, you, and to make it an enjoyable, safe, and healthy opportunity to come back and visit our place is great. Why would we not do that, right? Why would we not say, listen, you're going to see markings on the floor there, 6-foot spacings. Please try and honor those. You're going to see one-way lanes down aisles. Please try and honor those. If you have availability of our cloth mask that can be relaundered, we'd encourage you to, bring your own cloth mask and wear that. We're going to try and keep groups to no more than groups of 6, and table spacings will be, like every other table, to try and honor those distances. I think those are all smart things that most customers are going to look at and go, wow, they really do care about me. I think that's great. I think those are just smart business practices. They're smart public health practices, and they're the way to go, in my opinion.
Yeah, so maybe one question in the back of people's minds is, we're going to make these preparations, we're going to order supplies, we're going to reopen, and then we see another increase in cases. What's your anticipation of different phases, maybe for both you and Sam, and do you believe that we'll go through a couple more rounds and cycles of these sort of more restrictive measures as necessary?
Well, that's a real crystal ball question. I don't know that I have the answer to that. I think what people need to recognize is the flu shot that you get every year has previous strains of different viruses in it. Like when I got my quadvalent flu shot this past year, it had H1N1 in it. Well, H1N1 was several years ago. So I think there's a real chance that until an effective immunization is out there, that we could see peaks and valleys very easily. And peaks and valleys could happen throughout the summer and throughout the fall. The way we're going to control that is by what we do as the public, as a business, and through regulation. It's possible. Nobody has a crystal ball for sure, but I think you would be naive to be not prepared to respond to a chance that we could see a second peak. We certainly are planning that in emergency management. We would be foolhardy to think that this is going to go away and that we don't run the risk of having a second peak or intersecting with the fall flu season. those are just things that you have to keep in your mind. I don't think anybody can tell you honestly for sure yes or no, but you have to be prepared for the worst case scenario.
Yeah, absolutely. I would agree. You know, it'll be hard to predict what happens because a lot of it is based on human behavior. And so being how we've never really done this before as a county, a state, or a nation, this kind of complete shutdown, at least in recent history, it'll be interesting. But Dave brings up a good point. You know, we'll more than likely see COVID-19 in our future for quite a while, even if we get a vaccine. But we are looking at forecasting of what flu and COVID would look like this fall and winter, and certainly the two certainly posed together is not a good thing. We know that our national partners at the CDC and the World Health Organization are talking about that and looking at those things. So, you know, I'd be remiss if I did not mention that we definitely encourage everyone to get their flu shot. We encourage employers, you know, if there's any way that you can assist your employees to be able to do that as well. It's a smart move to, one, protect them, but also reduce that absenteeism. Other things about preparedness that Dave mentioned that I thought of, you know, run these scenarios while you've got time now and going throughout the summer. Run the scenario of what it looks like if you were to be open 50%, 100%, and if you were to have an outbreak in your facility, looking at what other organizations across the state and nation have done in response to that, be able to know kind of the pitfalls of the decisions that have been made that were not good decisions, and then the benefits and lessons learned that have occurred, because being prepared for those things is definitely a benefit. You know, more than likely going forward, we will see cases. We will get notified to the disease surveillance system, and our staff here are going to be hard at work doing those investigations and contact tracing. So more than likely, you will have employees that get sick and will be in contact. So knowing what that looks like and feels like will be important.
Yeah, I'd agree. You know, I think the best thing we can do as a community and as a group is really try and be prepared. And now is definitely the time to push, making sure people get their flu shots, making sure their personal behaviors change and their business practices change. Maybe we start instituting policies like we did early on at county government, where, you know, you're required to clean your workspace and your frequently touched areas with some regularity. You know, we decrease the amount of shared items that we share back and forth between customers and employees. Because I think, you know, COVID's going to be around for a while. When we get a vaccine is really anybody's guess. I know there's a lot of people working very hard globally on it, but I don't think anybody has a crystal ball and can say for sure when that's going to come out. And at the end of the day, there are going to be people that don't get that vaccination. I mean, we have that right now. People that don't get the flu shot for whatever reason, whatever belief they have, they don't get vaccinated against a variety of different things. And so how are you as an employer going to deal with that? One of the reasons we've been so successful down here in nursing homes, where we have the most highly vulnerable population, is early on we started doing routine calls with those care centers and sharing best practices and sharing what was going on amongst the different care centers with the staff and with the residents. And it really was the key to our success so far on not having an outbreak down here, because everybody thought, you know, we're going to do everything we can to keep our staff healthy and our clients healthy because we know they're at the most risk. I think that's a great model for any business community, you know, whether it's through the Chamber of Commerce or Think Iowa City or Downtown District or anybody, you know, to have a weekly newsletter or have something and share those best practices that people are doing so that others can model that behavior. Because until we change our behavior and until we get a successful vaccine, we're going to see peaks and valleys. That's just the reality of it.
Had some questions come in about kind of the practical day-to-day changing of operations with employees. So if an employer is ordered, let's say, an infrared no-touch thermometer, they want to check temperatures of their employees at the start of a shift, do they need to do that in private to protect employees' health information, or should they stand in line prior to entering the facility? What's the best way to go about this?
You know, I think honoring people's privacy is a good thing. I think it'll make them feel more comfortable. I certainly don't think it'd be a violation of HIPAA. Those govern kind of very specific things for obviously services rendered at cost. But anything like that when you're working with employee health, certainly look at your HR function or other HR resources for that. But anytime you're talking about employees' health, if they're asking if they're having symptoms of things, I think doing it in private, they'll appreciate that, and then they'll probably more than likely be more forthcoming too, and that's important. And just being upfront. I think there could be the ask of employees, hey, self-screen before you come to work, but let's be honest, people will forget, or you're going to get a lot of people say, oh, 98.6, here for work, or things like that. So, being mindful of their privacy is an important part of that process.
What would you say are the things that maybe we've had a question come in, looking ahead, what can we expect when our kids go back to school in the fall? Are there any preparations being made for that currently in our local county? And what should people be preparing for?
So the school districts are on our call most days. And I know the school districts are taking a variety of different thought processes on what they're going to do. I don't know that I've heard anyone nail down and say for sure what that's going to look like. When school is going to start exactly, if it's going to start early or late. We've heard speculation both ways. How they're going to check temps, if they're going to check temps. I think that's going to vary district to district, but the districts are having those discussions. And I don't think, well, I know for a fact, I have not heard any firm plans on exactly what any of the local Johnson County districts are going to do, absolutely ingrained in stone. But they're all looking at a variety of different things. I mean, we shared this week a lot of no-touch thermometers that simply you walk through an area of a building and it checks temperatures. There are places looking at that. Obviously, there's costs that come with all those things. I don't know anybody that really knows. I can tell you the school districts are taking that very seriously, and I think the University of Iowa is as well. We're just kind of trying to figure it out, to be honest with you. I think what Sam said's right. We have people that will just commonly forget to take their temperature at home. And so I don't think it's a big ask. We do it here in the EOC. We ask people, and for a while we had someone taking their temperature as they walked in the door. But I can tell you, every time I come in the building, I check my own temperature just to make sure I'm okay. And we've had no one report to this building that's had a flu, and we've got a scarce commodity of the dispatchers, the 911 dispatchers in the building. You can't replicate those quickly. And so we really needed to keep them sick. Same way with the EOC operations staff. There's hand sanitizer all over the place, and we ask people to check their temperatures, and we try and do that as discreetly as possible. I think those are good business practices related to the school. I could see them doing stepped up education on hand hygiene, trying to make sure parents are keeping their kids home if they're sick. I think schools now understand what distance learning looks like, and I think that is probably going to be part of their toolkit if something detrimental would happen at a district or a building. I would not be shocked to see increased temperature monitoring of students. That wouldn't shock me at all. But no one has given me a direct statement that any of the districts are doing X, Y, and Z. I think they're all still trying to figure out what they can afford to do and what those best practices are.
Yeah, like Dave said, I completely agree. I don't think anyone knows really what our future holds, but I know that there are a lot of people thinking about that and wondering. I think it's unfortunate that we're in this kind of situation, but again, if you have students in the school district, just to continue to remind them, reassure them, because I'm sure if they're old enough and they definitely recognize this dramatic change, it is scary for them and concerning. And so just remembering to reassure them and everything, and just talk to them about that in different ways, because I can imagine, if looking at our future and if we see outbreaks in schools and things like that, that language is scary. It's scary for adults too. So being cognizant of that will also be important part of that.
I would like to kind of do something a little bit different now. I'm going to share my screen. and show you the what to do right now considerations document that the downtown district worked with Robin Hepker of Benson and Hepker Design to put together. Are you able to see these, Dave and Sam, as we go?
We
Great.
can.
Yep.
So
yeah.
I'd like to start with just kind of going over this with our folks and point to the attendees where we'll have the link at the end where you can click on it and follow. But these are some quick considerations that businesses can take as things open. I mean, things are changing daily, so they're trying to update this, make it a living, breathing document. So maybe start with some retail considerations. So I will point out these are live buttons on the side as well, so you can click and follow them to follow specific guidance from the CDC, the FDA, the Iowa Department of Public Health, OSHA, the City of Iowa City, and then the Downtown District's link. So in terms of retail considerations, do you both have any suggestions for retail businesses? The suggestions that have been coming from these regulatory agencies are 6 feet of space between customers, try to get a 50% decrease in the normal legal capacity. Can you both comment on how do you determine legal capacity, or if you've been given any guidance by officials as to what that is? Is it fire marshal capacity?
Yeah,
Or,
what they're referring to there is the fire marshal's legal occupancy capacity.
okay.
Yep.
So, gosh, that's still pretty crowded, isn't it? Even at 50%, it could be. So
Yeah, but a lot of them, if you keep in mind, bar spaces are being eliminated from that footprint.
okay.
So if you're looking at the downtown area, a lot of those places that are reopening, it's still the bar space is not being allowed to be open. So if you're
Okay.
really looking then at your footage for your dining space.
Now, in terms of looking at kind of making customers feel clean and safe and increasing cleaning, doing sanitation in front of people as they're coming in, just making kind of more of an open show of those hygiene practices that maybe used to be done behind the scenes, right? The Disney method of making sure everything's clean and no trash. Maybe it's now important to come out and make sure we're showing our customers and our guests that we're cleaning regularly. Are there any other things you would suggest for retail operations?
I love the Disney method. I love the fact that when you go to a lot of these places nowadays, you're routinely seeing staff cleaning and wearing an appropriate level of protection. Whether, again, I'd caution people against the medical grade gloves, but you can wear gloves that have a vulcanized or rubberized membrane on them that can easily be dipped in 1 to 10 bleach and water, re-cleaned, re-sanitized, reused. I think that makes a lot more sense using stuff like that for taking out the trash, changing recycle bins, et cetera. I think it just goes to show the public that you as a business are really taking the health, safety, and sanitation seriously for both your employees and your customers.
Yeah, absolutely. And, and before the grand reopening dates and everything, walk through these and walk through your practices, do dry runs. What does that 50% look like? Are you able to do less? What does that spacing looks like? And just, I think practicing these out and getting kind of the finalized touch of what that will be in practice will be really important too. Because, this is going to be a bit newer to some folks, and others that may be very dramatic, right? If you've never really done cleaning throughout the day for your facility, because when you shut down at night, you have a cleaning company do that. What does that look like during the day with the existing staff that you have? So I think walking through everything will be really important and key.
Now, restaurants, we've talked a little bit about that, limiting customers, reducing the time people spend in their business. Are you getting a sense of whether or not the public is really going to be comfortable sitting in a restaurant at a table, or if we've gotten accustomed enough to the curbside pickup right now that we aren't necessarily as limited as other communities are around the country? So we're wondering if you think there are any kind of other practices that folks can take that would help improve comfort of customers.
I think the curbside pickup right now is the best method right now, because we still don't have a vaccine and we still don't have a good way of being able to prevent this other than staying at home. And so as we see these mitigation measures for the community relaxed. I think if we are still able to take the safer, more cautious approach, I think people will be comfortable with that. A sense of whether or not people will want to kind of run out there as soon as the gates are open, I don't know. I think maybe the first couple of weeks, people will still be very cautious. This has been a very dramatic and traumatic change for a lot of people, but people are creatures of habit. And so eventually, once they start seeing other people out there and there is a lag between cases rising, we may see people say, it looks okay. And then, people want to go back to their usual behavior. So.
Yeah, I'd agree with Sam. I think the places that have been the most resilient to this are places that have drive-through or already did a lot of delivery or use a lot of Grubhub, DoorDash type services. The people that have gone to pickup, parking lot pickup, those people have been pretty successful. I think you're going to see a lot of caution for the first month, probably, of people wanting to go back in and be dine-in customers. But Sam hit on the head. People are creatures of habit. And at some point, they're going to go, okay, I feel comfortable enough going back in and sitting down. I can tell you, it breaks my heart. We have a family ritual of every Saturday night. We go out and we've got a handful of places we love to go, and you're there for the environment and, the dining experience. And, it's been 50, 60 days now since we've been to some of those places, but we still frequent the ones that are open by using, pickup and we order, online or over the phone and go pick up our meals. And we would hate to see them go out of business. So we're doing our part to still, make sure that they get revenue, even though we can't go sit in their establishments. So I think anything that the business can do, the business community can do to show that they're really taking this serious by keeping their employees healthy, providing good environmental protections in their institution, using good hand hygiene, trying to keep their customers healthy, will be reassuring to the customer and make them feel more willing to come back in and get back to, the routines.
One other question we've had is about, you see these practices here on that we're advising businesses to take. What happens if I interact with a business that maybe hasn't taken those precautions? Is there going to be a reporting mechanism, or what's the best way to share that information without really causing harm to the business, in a quiet way?
Boy, that's a tough one. We get a lot, and we have since day one, of calls here at the 911 center of people calling in other businesses or just, complaints in general of people violating any of those governor's proclamations or orders. I can tell you for myself, I've called in a couple that were just flagrant problems that were not business related and had officers go out and talk to them. I think everyone's trying to take the education approach first. I don't know of anyone in the area that's written any citations related to any of the violations of the proclamations. If it's happened, I've not been made aware of it in Johnson County. I think everybody's trying to take that education approach. And obviously, if you can do it one-on-one with the management and supervision staff of a business, that's great. I would certainly not think twice about calling over a manager if I was in a place of business and saying, hey, I've got concern about how you're doing business. Isn't the recommendation this? And trying to handle it one-on-one as opposed to going out there and yelping it or, just trying to make a big social media spectacle of it. I think that's really counterproductive. I've never been a huge believer in that. Most people want to comply, and I think we're Iowans and Americans, and we generally want to do the right thing. Oftentimes it's just error or omission or lack of training. And if it's pointed out in a non-controversial or a non-confrontational way, most people will self-correct and take care of the problem. And I think that's what we want to encourage is, an education and correction as opposed to, saturating the 911 lines or the business lines of law enforcement with those types of things.
Yeah, I'd have to completely agree. When Dave mentioned that it's either lack of training or omission or error, I think that's we have new staff, or maybe if it's too busy and they're wanting to cut corners for trying to keep up, and just being sure that as a employer or manager that you're aware of those type of things, and definitely encouraging people to take that road and speak with the management, just addressing those concerns, because in the long run I think that would be the most productive.
Well, so I really appreciate both of your time today. I'm scrolling through the rest of the document. We're wrapping up here. Is there, talking a little bit about the door signage that the downtown district has put together? I know the Iowa City Area Business Partnership will be putting some things together for their members, as well the Iowa City Area Development Group and Think Iowa City, as each of their constituents are kind of different groups. But is there anything we didn't talk about today that you want to make sure to share with everyone on the webinar, or people that are going to watch later on?
Nothing comes to mind. I mean, we've spent an hour talking about the topic, and I think the reinforced message has to be that of good social responsibility, good business practices, good hand hygiene, good public health recommendations, and just that sense of we're going to get through this, and we will. We will get through this, and we'll all come out smarter on the other side and go, you know what, when the next outbreak happens, here's the things that worked and worked well, and here's the things that were like not great at all that we did that, God, if we had a do-over, I've got a list of do-overs already in my box. So I think the big focus is going to be on really emphasizing to the public and our customers that we take our health and safety of our employees very seriously, and that we would hope that in order for us to be a successful business, that you would try and comply with these asks from our business in order so that we can serve you and not have people sick.
Yeah, absolutely. Again, to just remind everyone to please be patient, please be kind. I think for all of us here, this is our first pandemic, unless you're from the 1917, 1918 era for the Spanish flu. So, we're all learning this together. We're all dipping our toes into this, or head first in this. So, depending on the day, we don't know really where people are coming from or what they've experienced. And so, the irrational or anger, anxiety is certainly rising, and it's a concern. But if we can be patient and kind with each other, we'll get through this together.
Thank you both so much. And thank you to the IC Area Together groups, and for both of you for your time. I know we've had you on these a couple times, and we'll probably have you back again. So thank you very much. We'll go ahead and wrap up now, and this will be posted later online for sharing. And take care. And I know you both have to get on an emergency management call here in an hour, so we'll give you some time to prepare. Take care, and thank you.
Thanks.
Thank you.